I'm going to be the patient that has periodontitis who has not been to the dentist in 5 years. My disc personality is the influencer. This means that I like to talk and I am motivated by social recognition. My fear is social rejection. The dental hygienist should give me public recognition, focus on the positive, don't overload me with the details, allow time to ask questions, don't interrupt me, and to be enthusiastic.
I'm going to be the dental hygienist that is not using motivational interviewing or following the DISC personality format.
I'm going to be the clinician using motivational interviewing and using the DISC personality format.
Hi, how are you doing today?
I'm doing really good. I was in traffic on the way over, and I'm really glad I made it on time. It's such a nice...
Cool, take a seat.
I'm a little nervous that I'm going to have cavities. The last time I came in, I had a few, but I was too scared to come back in and have the dentist fill them. I'm not really a fan of needles.
Yeah, I noticed you haven't been in 5 years, so there's probably a good chance of that.
Well, I actually bought a new tube of toothpaste to help with the cavities. I think anyways. My old tube was in a white tube, and I bought a new one that's in a red tube. Do you think that'll help my cavity problem?
Do you know what kind of toothpaste it is, or do you only know what color it is?
I saw a commercial for a toothpaste that helps with cavities on TV, and it was in a red tube. So I went to Walmart and I grabbed the one in the red box.
Okay, well maybe next time pay more attention to what you're buying because I can't tell you if I recommend it if I don't know what it is. Did the periodontal exam. So I noticed after doing your exam that you have 5mm periodontal pockets all over your mouth. Not coming in for 5 years really did a lot of damage. Read this pamphlet about periodontal disease because that's what you have. So tell me, what is your diet like?
Well, usually I don't have time in the morning to make anything at home, so I usually grab something at Starbucks when I get my Trenta Mocha Cookie Crumble Frappuccino. Then I grab some stuff from my vending machine at work and drink it with my frap for lunch. Carl from marketing usually brings scones or donuts into the break room 3 times a week, so I'll usually have some of those too. I get off work pretty late on weekdays, like around 9:30, so I usually swing by Taco Bell. It's my favorite. But if the line is long, McDonald's or Taco Time are my next go-tos.
Okay, so we're going to have to fix all of that. All throughout the day, you're constantly eating sugar, which is causing serious damage to your enamel.
Well, what does that mean?
The bacteria in your mouth are eating the sugar from all the frappuccinos and donuts and are creating acid on your teeth. That's why you're getting cavities. In order to prevent decay, it's really important that you cut out a lot of sugar from your diet. So tell me about your daily oral hygiene routine.
I used to not brush my teeth very often because I didn't like the taste of the minty toothpaste. But I knew I had to, so I made myself brush once a day. But sometimes I still forget. But like I said earlier, I saw a commercial for this new cool toothpaste that is supposed to be really good. I went and bought it last night, but I actually haven't tried it yet. I hope it tastes better than the old one, and I hate flossing. Every time I floss, my mouth bleeds. I hate the taste of blood, so I just don't do it.
Okay, so we have a lot to work on. It is very important that you're brushing twice a day, morning and night, especially with your high sugar diet. Also, you really need to be flossing every day. The reason that your gums are bleeding is because you're not flossing at all. Flossing regularly should stop the bleeding. Your lack of flossing is also a reason why you have periodontitis. If you improve your oral hygiene routine, you can prevent it from getting any worse. Does this sound like something you can do?
I'll consider it, but I have a couple questions about what my treatment's going to be today.
Well, we're running out of time, so we're going to have to just get started with your cleaning. When the doctor comes in for the exam, I'm going to have to let him know that you're not doing very well with your home care and your diet needs to be changed.
How are you? It's so good to see you.
I'm doing really good. I was in traffic on the way over, and I'm really glad I made it on time. It's such a nice day. I'm thinking about maybe going on a hike later this afternoon.
Good. It is such a nice day. I'll have you take a seat here and we can get started with your exams and cleanings. So I noticed that you haven't been in 5 years. Can you tell me what's kept you from coming in? I'm so glad to see you today.
I'm a little nervous that I'm going to have cavities. The last time I came in, I had a few, but I was too scared to come back and have the dentist fill them. I'm not really a fan of needles, and when I had one filled when I was younger, it really hurt.
I totally understand where you're coming from. Well, I'm really happy and proud of you for coming in today. What does your home care look like? Can you tell me a little more about it?
Well, I actually bought a new tube of toothpaste to help with cavities. I think anyways. My old tube was in a white tube, and when I bought one, it was in a red tube. Do you think that'll help with my cavity problem?
I'm not sure which toothpaste you were talking about, but I'm really happy you bought toothpaste with the intention of helping your oral health. That's really awesome. I get the feeling that you really want to improve your oral health, so next time you come in, you can bring it in. Then we can take a look at it together to see just what benefits it'll have for you.
Okay, I'll bring it in next time.
So now I'm going to do an exam to check the health of your teeth and gums. Does periodontal exam. So during the exam, we typically want to see 2 to 3 millimeter pockets, and as I was doing the exam, I did notice that you had some 5 millimeter pockets. However, the good thing is there aren't any pockets deeper than 5 millimeters, and we can take precautions to help maintain and not further damage and deepen the pockets. So your diet has a lot to do with the amount of biofilm and calculus formation, which affects the amount of bacteria in the pocket around your tooth. So let's talk about your diet. What does your diet consist of throughout the day?
Well, I usually don't have time in the morning to make anything at home, so I usually grab something at Starbucks when I get my mocha cookie crumble frappuccino. Then I grab some stuff from my vending machine at work and drink it with my frat for lunch. Carl from marketing usually brings scones or donuts into the break room 3 times a week, so I'll usually have some of those too. I get off work pretty late, like around 9:30, so I usually swing by Taco Bell. It's my favorite. If the line is long, McDonald's or Taco Time are my next go-tos.
I totally understand that all the foods from fast food restaurants are very convenient, especially when you have a busy work schedule. However, they contain a lot of carbohydrates and sugars, which feed the bacteria on your teeth. This can increase the risk of cavities if you aren't removing these after you eat. So what is your dental hygiene care routine?
I used to not brush my teeth very often because I didn't like the taste of the minty toothpaste. But I knew I had to, so I made myself brush once a day, but sometimes I still forget. But like I said earlier, I saw a commercial for this new cool toothpaste that's supposed to be really good. I went and bought it last night, but I actually haven't tried it yet. I hope it tastes better than the old one, and I hate flossing. Every time I floss, my mouth bleeds. I hate the taste of blood, so I just don't do it.
I can see that you want to change, but maybe we just haven't found the routine that works consistently for your schedule. Do you feel like you want to discuss ways in which we can get oral health care in your schedule consistently?
I'd love to.
Awesome. Let's get you trying that new toothpaste and see if that flavor is something you like. I'm really proud of you for brushing once a day, but let's try to get it up to twice. And brush for a second time, like when you shower in the morning or night or maybe after you eat dinner. Let's try to get you flossing at least 1 time per day. The more you floss correctly and often, the less bleeding that you will have. Do you have any questions, or does that sound like something that will help you get in a better routine?
Yeah, I will go floss and try out that toothpaste today.
On a scale from 1 to 10, how motivated do you feel to make these changes?
I'd say about an 8. I'm just not really excited about flossing.
That's great. I believe in you, and I can't wait to see the improvements you will make. When the doctor comes in, I will let him know that you are making an effort to change and let him know our game plan. Do you have any questions before we get started on your cleaning?
Not at the moment.
Perfect. Well, let's get to it.